Before COVID-19, we had a trajectory. We said we would do research, train our staff, have a clinical research unit open by May, and we'll be open for business. Pharma will come in, we'll do clinical trials. All of a sudden, there's a setback. And I look at it, we in Kenya have been doing well. We had issues during the elections. There was a standstill in progress. We look at people in the Middle East, in Iraq, in Iran, in Syria, facing war. For them, COVID is like a piece of cake. They think like they've been facing COVID all along, although it's not infectious. I think we are learning a few things. That we are a global community, that anybody, as his Highness said himself, anyone in China sneezes, the guy in America will catch a cold. So we realize that we are not in this alone. So the research we were doing in cancer, in heart disease, has probably put on standstill, but the same ideas of asking the right question to get to a key answer that will help us in the future can be applied to COVID. The difference is COVID is very infectious, it clearly can be lethal, so while we're trying to do research on COVID, we need to at least find a way to have not social distancing, but physical distancing, which also means that if we have another COVID day after tomorrow, is Kenya prepared? Are our farmers prepared? Are our markets prepared? Are our populace prepared? Is the matatu driver ready to say, I will reduce the number of patients, the people on my truck? That requires government approach. So I think the government has to be in this, both feet on the ground. NGOs, civil society has to be in this. We have to work this together. But the government also has to provide leadership. I was totally impressed that we were telling the populace to shut down churches, no gatherings. You come in on the plane by Wednesday, we put you into isolation until we test you. That is phenomenal. That is as good as anybody else could do it. I hope that the same could be applied to the populace. Now, I listened to the young woman who says, listen, I'm either going to die of starvation because I've got children, or I'm going to die of COVID. I'd rather at least feed my children. Those are issues we face in reality for populations that are going from hand to mouth. That is where government has to play a role. We in civil society, in academia, and those who are fortunate can at least do some research to say, how will we tackle this better next time? Will we have drugs ready if it happens? Will we have a vaccine ready if it happens? That's our responsibility. The responsibility of the government is to be able to provide infrastructure to help those who need help in terms of medical care, medical support, because the bills for patients will be rising astronomically. The hospitals have to be paid because otherwise they cannot function. How do we work this out? This is the time to think about it because another COVID is coming our way sooner than later. This is the time we should really come together as a country, as a people, to come up with solutions, not just for today, but also for tomorrow and the day after.